Hi, my name's Maddie Pearson and today I have been dispatched to a 78-year-old woman, Mrs Jones, who is feeling generally unwell. Today is the 7th of May and it's 1800 hours. So far before you came in I have used dollar and ample to determine Mrs Jones's chief complaint and find out her past medical history and all that sort of thing. Where you're coming into now is where I will be performing the vital signs survey. So I'll be determining Mrs Jones's blood pressure, taking her pulse, also taking her chest, Glasgow Coma Scale, all the things that we would do in a vital signs survey. Yeah. Alright, so the first step in taking a vital signs survey is to take the heart rate and the respiration rate. So Mrs Jones, just going to run some tests here to see what's going on. So the first thing I'd like to do is check your heart rate.
Yeah.
Yeah, so if you could push up your sleeve here and if I could have access to your arm.
Yeah.
Awesome, that's great. Lay it down like that. Very nice. So just gonna... A very strong pulse there, Mrs Jones. Very nice.
That's good.
So first of all here we would find the radial pulse in the lower arm just below the thumb. And then I would tell Mrs Jones that I am counting her pulse for a minute. So I'm just going to count your pulse here for a minute, Mrs Jones. Shouldn't be too long. Okay, so for the first 30 seconds I would count the number of pulsations that I felt underneath my fingertips, and then at the end of the 30 seconds times that by 2 to give me an overall heart rate. And for the second 30 seconds I would look for Mrs Jones's respiration rate. So take a slight shift this way and look for the rise and fall of her chest, and at the end of that 30 seconds, which is the overall minute, times that by 2 as well. If I am struggling to see Mrs Jones's respiration rate, as I am now through her quite bulky jumper, I just say, Mrs Jones, I'm just going to move this up here to get a better feel. And then feel the rise and fall of her chest from her arm. Alright, Mrs Jones, that seems all good there. Very nice. Thank you. You can pull that one down.
Go.
Okay, Mrs Jones, so next I'd like to take a blood pressure on you, if that's alright.
Yeah, that's fine.
So I'm going to need access to your upper arm here above the elbows. So would your jumper push all the way to the top, or would we have to take it off?
I think we'll have to take it off.
Take it off? Okay, do you need a hand there?
Yeah, that'd be good.
Okay, put this up from the bottom. Alright.
And can you just pop it on the chair?
Pop on the chair? I certainly can. Okay, so if we also push this one all the way to the top?
Yeah.
Does that fit? There we are. Nice. So I'm just going to put this cuff on your upper arm up here. So just underneath here. That's not too tight for you there, Mrs Jones?
No, that's fine.
Okay. So I've just put this cuff an inch above the crease of her elbow in here. Oh. Right, yeah, it's all good. Next we're going to find our radial pulse, as I did for the heart rate. Very nice. Okay, make sure the knob is down tightly and pump it up until I can no longer feel the radial pulse. Just give me a slight pressure on your upper arm there, Mrs Jones. And let it out until I can feel the pulse come back again. And let it all the way out. Very nice, Mrs Jones. Do the knob back up. Have you had your pulse, had your blood pressure taken before, Mrs Jones?
Yeah, I have.
You know the next step then.
Yeah.
So next we locate the brachial pulse in here, in her elbow. There, stick our stethoscope over the brachial pulse just there. Hold it on. And then next we pump up the cuff again to 30 higher than the value that we got from the one before. So just another pressure on your upper arm there, Mrs Jones. Slowly let it out again till we get a thumping come back, thumping pulse. And that goes away, that's what we record. Rightio. There we are, Mrs Jones. So today I got your blood pressure of 110/70. Is that normal for you, do you know?
Yeah, I think that sounds about right.
Very good then. Okay, Mrs Jones, so the next thing I'm going to do is perform a chest auscultation. So I'm going to listen to the sounds of your lungs. That's okay with you?
Yeah, that's fine.
Okay, so at the back I'm just going to need to put my stethoscope to the skin. So is it okay if I either lift up or go down your top just a little bit?
Yeah, that's okay.
Okay, good, thank you. I'll get you to lean forward and place your hands on your legs. Yep, just like that. I'll give you a little cough and then a couple of deep breaths just quickly. Okay, and now breathe normally. So starting at the top between the scapula and the clavicle, you listen for 2 cycles worth of breath. And then move across to compare to the other side. And then move down the border of the scapula and go under here. I'm just listening to make sure that there are no irregular sounds, nothing like that, no crackles or wheeze, nothing like that. Making sure that there's adequate air entry all the way to the bases, that everything's normal. Okay, Mrs. Jones, so everything seems to be sounding alright there. Thank you very much. Okay, so next we're going to perform a GCS score on Mrs. Jones. So Mrs. Jones, next step in my vital signs survey today will be to just ask you a few questions. They might seem a bit odd, a bit silly, but they're really going to help me in assessing you today.
Yeah.
Is that okay?
Yeah.
Okay, so the first question is, what's the day today?
Tuesday.
And the month?
May.
And the year?
2013.
Good, and why am I here today?
I've just been feeling unwell for a bit.
Okay, so the next one's just a little activity that I'm going to get you to do. All I'm going to ask you to do is just to grab onto my fingers,
Yeah.
give them a squeeze, and now let go. Good, that's all good. So Mrs. Jones's eyes are opening spontaneously, so that gives her a 4. She's obeying command, so that gives her a 6 for motor, and she's orientated to time, place and person, which gives her a 5. So her overall GCS score would be 15. So far Mrs. Jones's vital signs are looking good, they're looking normal. Throughout this video and my time with Mrs. Jones today, I've used a mixture of non-verbal communication skills, including getting down on her eye level, using appropriate levels of eye contact, appropriate touch, gesturing, and keeping an open body language and posture so that she felt comfortable and warm around me.